that even the doctor, the nurse, all the staff, they did so much to him to be what he is now. I really thank Baylor, thank it so much. When Baylor opened, I remember when as a translator, the psychosocial support to the patient and even to the community. Here at Baylor, I'm the staff member of the Wise Group, support group, and the caring fathers. We have the caring fathers. You know that it is very hard for Bondade to take care of the children, let alone the children who is living with HIV. So I really like to support them. That's why I attend caring fathers. This is my story. Thank you very much.
In those areas of the country, and that was really a major turning point for us. We also got some generous support from UNICEF, which helped us to fund those outreach activities. So then, moving forward to 2009 is really when we started to really see decentralization of that specialized care. In 2007, the then Prime Minister of Lesotho visited Houston, and there was an announcement of funding in those areas of the country, and that was really a major turning point for us. We also got some generous support from UNICEF, which helped us to fund those outreach activities. So then, moving forward to 2009 is really when we started to really see decentralization of that specialized care. In 2007, the then Prime Minister of Lesotho visited Houston, and there was an announcement of funding. Fantastic, but still challenging when it snows, and we still do have many remote health facilities in Lesotho. So it's beautiful, 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 but not easy to reach.
Well, thank you so much.
Thank you so much.
It has been incredible, and we're really privileged to be associated with the work you do, and very proud of what you and the entire staff have accomplished here. It makes a very big difference. And just in a very short time we've been here, I think we've all understood the great impact over so many years. You and you first, and now you and the entire team is having on a community, and it's really heartwarming, and well done.
Thank you.
Thank you.
Thank you so much.
Very
Thank you for sharing.
Thank you so much. Thank you.
So before we
So it's one of the donors seeing the patients, but we want to show the face of the
We don't want to serve anyone.
But there are also nurses who have two oncology nurses who are trained in Zimbabwe. One completed in 2018, the other one completed 2019. We have today amongst us a Fulbright specialist. She is I think she will sorry, just a minute. Okay, no, you won't take patients. So the Fulbright specialist, we applied for a grant to have someone come from anywhere to come and assist to build capacity in country, so that we have at least more support to the two oncology nurses who are giving chemotherapy. So, U.S. Embassy funded for Dr. Angela. She's with them, and amongst this team that is here, we have nurses not only from the nurses did not have capacity in oncology, and Angela is here to help build the capacity so that we are able to start with chemo here. For long infusions, we are even able to rule after this training, and after this training, when we are
for management of side effects, and we were meeting at Queen Mamhado with the surgeons and with the gynecologists for multidisciplinary team meetings to agree on the treatment paradigm. And some of the patients, when they are treated here in the city, done with surgery, done with chemotherapy, now we refer them to Bloemfontein. And another one is the volunteer. Now, after the closure of the end of the project, most of our staff, we're still trying to have them retained and employed under government, but the processes have not really started to Thank you.
Alejandro is here to help do that, right?
Yes, I was here and we were happy to be part of.
He was our public health president.
Oh, he's all right?
Yeah, he just finished. He's finished with us now.
Honorable President of Senate, His Lordship the Chief Justice, Speaker of the National Assembly, Honorable Deputy Prime Minister, Honorable Ministers of His Majesty's Government, Honorable Members of the two Houses of Parliament, Excellency, members of the Diplomatic Corps and international organization, and I would like to welcome the Ambassador of the United States, Ambassador Maria Brewer, Government Secretary and Principal Secretaries and senior government officials, Chief Executive Officer of Bristol Myers Squibb and his company, Dr. Kefario, Ms. Santralu, and Mr. John Damonti, Vice President and General Counsel of BMSF Company, President of Bristol Myers Squibb Foundation, distinguished guests, ladies and gentlemen, and all protocol observed. My name is Masiabata Ramatebane from the National University of Lesotho. I am the principal investigator of sankatana NUL oncology clinic project, and today I will be your MC, and I am going to start with opening prayer, and May will come and make a prayer for us. Thank you. My name is Dr. Lucy Mapota Maswabi. I'm the Director of Clinical Services from the Ministry of Health, but today representing my Director General Health Services, Dr. Nyani Litsie. It so happens that the chief that has not spoken, I'm actually under his jurisdiction because all the docs are away. So you are most welcome and feel free to be here. Thank you very much. That being said, I have an assignment today to actually give the objective of our coming together today in honor and remembrance of the hard and selfless dedication by Ms. Pangisile Nsadi, who was the regional director of Preston Mayor Squib, who has contributed a lot through this organization or the foundation and helped the Ministry of Health in the fight against HIV, which started many years ago.
For my part, talking about the partnership between Sankatana and BMSF and Lesotho could be said by Dr. Poko if he was around with us. I had wanted him to be making a few remarks on this partnership because he knew Pangisile Njali so well. They worked very well during the fight of HIV. Unfortunately, when I wanted him to join us on this ceremony, he was already very sick and now he has departed. May his soul rest in peace. How I came to meet Pangisile, I can't remember which month it was, but it was somewhere in 1999 when Dr. Poko called me. Then he was the Minister of Health. He called me to his office and said, you know, I've heard there's a foundation from America. They are offering some support to us in Southern Africa. Do you know BMSF? I said, BMSF is such a long name. It's the first time I hear about BMSF. What does it stand for, Ndate? He told me it stands for Bristol Myers Squibb Foundation. That was the first time I heard about this foundation. The BMSF decided my direction in health. I started working with BMSF. Pangisile Njali, actually, from the first meeting, she was happy to find me joining that section because the community didn't have a lot of doctors. So I think I was the second doctor to join the community side. That time, the proposal that came from Lesotho, they were mostly from the community. And he brought the proposal to us to review with her, and then those that were selected, and even those that were not selected, wanted us to go to their places and find out what exactly did they want, because sometimes, especially for community-based organizations, sometimes people know what they want to do, but they're not able to express themselves on paper what exactly they want. So we had to go to different places in Maseru and outside Maseru, where those people had written the proposals, and truly only to find that some of the people could not be able to express themselves well. They knew well what they wanted to do, and were part of the proposals that got funding. That experience, I took it so much that most of the time we want very good written proposals, but still there are many people that had to be told about what HIV is, how to prevent ourselves from it, and so on. So the proposals was about writing pamphlets and booklets and starting trainings on home-based care and so on. We worked for about 3 years, moving around the countryside. But after those years, Tate Poko even said, you know, I realized you used to say, it's my Zulu warrior. Muzulu na umata, itawanga akabone, bitere na akakatusa jang. Then I wanted to decide how best he can help us. Soon after that, BMSF decided to open clinics for us. I know in Lesotho we wanted another clinic, but in other areas they preferred prevention of mother to child. So we worked very hard, and she helped us so much because what we didn't have, she gave us consultants to come and help us with trainings, with training counselors, physicians to train the doctors, and eventually had sankatana came. The longest years we worked with Pangi was with HIV/AIDS. Thereafter, BMS changed focus to work in cancer. But other countries in Southern Africa were much advanced, not even advanced than us. For us, we had nothing. Saying, why don't you talk to each other? And we were facing a lot of problems, and the solutions were within us. That's why she was shouting at us. At this point, may I call Mr. Mangaliso Mjali to come and address us. Thank you.
Program Director, for this opportunity to speak on behalf of the Mjali family. And thank you to the honor bestowed by the Basotho people in this plaque that we have just unveiled. We are truly humbled and honored that this plaque captures my mother's passion and vigor and activism in improving access to quality health in the global south. Thank you for their tireless work in improving the quality of lives of patients. Thank you to the Ministry of Health for working with my mother to make this vision a reality. Lastly, I'd like to thank our second family and my mother's home away from home, the BMSF family. Thank you, Uncle John. Thank you, Uncle Giovanni, for trusting my mother with your vision and good works. I'd like to wish all the dedicated professionals all the best at this center and all the best in delivering quality health for the communities. We know we will make Mama Pangi proud. Thank you.
Thank you, Program Director. Like you have said, my name is Mudia Hintene. I'm the Principal Secretary of the Ministry of Health. Program Director, allow me to pay my respect to His Majesty the King, the Third, the Right Honorable the Prime Minister, Honorable President of the Senate, His Lordship the Chief Justice, Speaker of the National Assembly, Honorable Ministers of His Majesty Government, in particular my Minister, the Minister of Health, Honorable Sidibe Muchoroboran, who is not here with us, and two members of the two houses of Parliament, in particular the Principal Chief of Tababusiu, our local chief, partnership for over 20 years. It demonstrates a sincere and deep friendship between us. You were with us during those difficult years. This ended with the establishment of the first antiretroviral clinic at This clinic offered treatment and care of the people survived. This clinic offered treatment and care, and the people survived.
From non-communicable diseases such as hypertension and cancer. In a way, I'm really sorry. We focused our resources on those most in need, children living with HIV. One of our first major partnerships was the development of the Baylor BMS Children's Center of Excellence. Today, I had the pleasure of visiting the center, and I was profoundly touched by the contributions of two people, Dr. Tahane and Dr. Mohapi. I want to thank Dr. Tahane, who provided such an impressive overview of success and growth, as well as impressive overview of the work of her mother, Dr. Edith Mohapi, who was the first director for the center. So another landmark partnership was the establishment of the Sankatana Center. This was guided by the vision of Dr. Pearl Nsechi, who created a partnership between the Ministry of Health and Bristol Myers Squibb to build Lesotho's first adult HIV treatment center. The name of the center came from a story in Lesotho, and we heard that story a few minutes ago. The Sankatana Center and the Kingdom of Lesotho made huge advances in the treatment of HIV, moving the disease from a death sentence to a more manageable chronic condition. As I said a few minutes ago, although there is more work to be done, we are incredibly proud of the progress that has been made and grateful to all of you for this success. In a way, Sankatana now had a new beast to slay, and that was cancer. Prior to the opening of the Sankatana Oncology Clinic, patients from the highest and furthest villages needed to receive passports and travel out of the country to Bloemfontein, South Africa, for treatment and care. It was inconvenient, uncomfortable, and added stress, both emotional and physical, to already vulnerable patients. And we just heard that the Sankatana Center can now treat patients here in Lesotho. While we are making progress, I commit to you that we will continue to improve and expand the services and capacity of this center. For a special recognition, and Dr. Pearl, I would like to read a certificate for you. In appreciation of over 20 years of partnership in addressing the health needs of the people of Lesotho. Congratulations. We are incredibly grateful for the leadership at the BMS Foundation through the late Pangisili Mishali. Pangisili joined the BMS Foundation 23 years ago, just as we were beginning our work in Southern Africa. She was an incredible force that helped make our country partners succeed in every way she could. Her vision, passion, and no-nonsense approach brought out the best in all of us. Much of what was accomplished here for BMS in Africa was the result of her efforts. I know I speak on behalf of all of us at BMS that we miss her dearly. However, she will continue to live on through all those she had touched and for generations to come. I am so pleased that today we have officially dedicated the Sankatana Oncology Clinic after Pangisili Mishali. Thank you.
Wow. Wow, wow.
And then connection with that.
Don't worry, because those for the don't worry about. You keep those ones.
Senza conosceva con lui mani.
Oh, con lui ma.
There's a lady that has.
Dai, che mi dà.
I don't know who she is. We're gonna get her.
Okay.
I just didn't bring them.
That ambassador was the only one. She had the gloves, she had the hat on, she was prepared.
She's actually going to Tabazenga up in the mountains this afternoon.